Good afternoon. Thank you, Minister Scott. Thank you for the opportunity as former Minister of Health to speak on this very important topic that relates to all persons that live and reside in Bermuda. One thing I'd like to comment on, and that is to refute the recent news report that I heard the opposition member, the shadow Minister for Health speak of, Health and the Aged speak of, and that was pertaining to the urgent care centers. We will have seen just recently, I think it was yesterday or day before yesterday, the announcement of a site for which an urgent care center would be set up. And I found it quite interesting, the comments that she had said that it wasn't known, there hadn't been any mention of it in throne speeches past. But one thing I'd like to comment, as when I was the Minister of Health, I did on the floor of the House speak to the desire to have us have such clinics, as I had called them, but urgent care units in the East and in the West, for the very reason that we have before us a King Edward Memorial Hospital that we recognize needs to be renovated, built anew. But in order to do so, and the opposition member had in the past made repeated reference to the estate master plan, it was within the estate master plan that there was mention made that we needed to address the issue of non-acute care. And in doing so, there was the proposal put forth that we would have those services rendered by satellite clinics in the East and in the West. They went so far as to identify places. One of the locations was on the very piece of land where the announcement was made just recently. So I found it interesting that she would make the claim that no one knew. I had spoken about it in every circle that I had the opportunity to do, and I also spoke about it on the floor of the House. Because if we want to see our hospital be that reputable institution of health care that we desire, and that meaning it will be dedicated to addressing acute care needs, we have to have in existence entities and institutions that can deal with the less acute, less emergency issues. And I was most pleased to see that we have at least identified a location, and to say that, well, we have no building plan yet. Well, of course not. I mean, you've just made the decision, so that will come once you have to get through the design phase of such a building, such as we have seen the urgent care center. Another thing I just wanted to just commend the people of Bermuda and also the various restaurants, and with regards to how they've graciously taken on and accepted, I should say, the ban on smoking in public places. I recall when it was introduced and passed in the House, there was the opposition from many, a bar and a restaurant, that thought that they were going to be losing business. I haven't heard anything to date. Mind you, I'm no longer the Minister of Health, so whether the Minister has heard anything, but I think it has been received without any issue. People are enjoying being able to dine in various establishments without having smoke. And then what you've seen now, at least within the Corporation of Hamilton, you have these cylinders that are outside establishments to encourage people, at least to provide a vehicle for the disposal of cigarettes. So I'm most pleased that that was received without any hindrance. And at the end of the day, we will end up seeing a reduction in the high healthcare costs that are as a result of smoking and secondhand smoke. If it leads to people stopping the behavior of smoking altogether, then that's a great thing. But we had to make our stand, and that's the stand that we took as a government. I'm also pleased that the minister is following through on the obesity plan. We see the most humorous commercials. Well, one would think they're humorous, but they are quite concerning when you think about our young people and even our older people that have challenges of weight. But we as a government, and I'm most pleased that the partners have joined in also, that we're taking a collective approach to dealing with obesity in our young people in particular, because there are programs set up in the school system to encourage healthy eating, to encourage more lively participation in athletics and activities. So all in all, at the end of the day, this contributes to a healthier people, reduction in our healthcare costs, and what more can one ask for? So thank you for that. That's a contribution that I felt, the areas that I felt important to stress that this government has done and will continue to do for the health and welfare of Bermuda. Thank you.